Hey friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in ElDorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to the second segment of Therapy Thursdays. We are Angela and Jerry Yarborough with Physical Therapy and Balance Centers. And today we're going to be talking about shoulder pain. Shoulder pain affects millions of people daily. And until I had a personal experience with shoulder pain, I didn't realize just how much it affects your activities daily. So what do you got to tell us about that?
All right, thanks. Yes, shoulder pain, it can be extremely debilitating. You may not think about it, but just being able to brush your hair with someone with a shoulder impairment can be very painful and unable to do that. Putting on a shirt, brushing their teeth, all of that stuff can be very painful. Now the shoulder is the most complex joint in our body. It is a very unstable joint actually. It is a ball and socket joint. And so like the hip is also a ball and socket joint, but the hip is deep and that ball sets deep into that socket. The shoulder is very shallow and the ball sits right here and the stability comes from all the muscles around it. So actually the shoulder joint itself has 21 different muscles that attach to it. And the whole shoulder complex is made up of the clavicle or the collarbone, as many people call it, the humerus, which is the part that the ball is, and then the scapula is the glenoid fossa where that ball sits. And the scapula actually is free floating on the back of our ribs, and the clavicle is really the only thing attached to our skeleton. The clavicle attaches through ligaments and tendons to the scapula and the shoulder. So we're going to be talking about the three most common causes of shoulder pain. Today we're going to just take one of those. We're going to be doing a series of at least three because there's so many different things that could be going on in the shoulder to cause you pain and limit your functional abilities. So the three most common causes of shoulder pain is going to be shoulder impingement, a rotator cuff, and arthritis. So come back in the next segment. We're going to get a little deeper into shoulder impingement today. And of course, we always leave you with some things that you can start doing immediately to help improve from your impairment and your pain. So come back in the next segment and we'll see you then. Hey guys, welcome back. This is Dr. Jerry Yarborough and my sweet wife, Angela. We're here coming from Physical Therapy and Balance Centers of Ruston, Jonesboro, in Louisiana, here in Louisiana Living. And what we're talking about today is shoulder impingements. All right, the shoulder impingement can be caused by a number of things. Most of the time, it's a repetitive injury that causes inflammation of the muscles and that causes an impingement. The area that we're specifically talking about is there's a little bone kind of at the end of the scapula. It's called the acromion, and it kind of sits like right here. And in here we have the glenoid fossa, or the socket of the scapula, where the humerus, which is here, sits in. And all these muscles around here have to, which is called the rotator cuff, they all have to stabilize that humerus in there in order for it to function properly. It has to pull it down whenever it rotates a little bit, so there's plenty of space, because that space between the acromion and the humerus here is very thin. So if anything is not aligned right or gets inflamed, we get an impingement. So like I said, most of the time it's caused by a repetitive injury. So what we're gonna do today is show you a few exercises that we could do to help you overcome your impairment with an impingement. First of all, if you would turn this way, you've got to make sure you have good posture in order for your shoulder to move properly. So your chin would be back, your ears should be in line with your shoulders. And the first exercise we're going to do is shoulder squeezes. So just standing with good posture, you're going to pull your shoulder blades together like that, pushing your chest out. I want you to hold it for a count of 10 and then relax. And you're going to do that 10 times. The next thing that you can do is what we call a wall angel. You can back up to the wall, turn your thumbs out, and raise your arms up. You guys know what a snow angel is, right? So you get lay in the snow and you do this. So this is called the wall angel. And it's to help maintain proper mobility and flexibility of the shoulder. Next, we're going to do what's called IYTs, okay? So you're going to bring forward, flex your shoulders as high as you can like this, and then kind of push them back even more. I want you to do that 10 times. All right, so like you're making the capital letter I. And then you're gonna bring your arms out and make a Y, kind of like the YMCA, right? You're gonna make a Y 10 times, and then you come down and make the letter T. And again, squeeze back, just 10 times. All right, there you go. Those are some great exercises you can start doing today to help improve your flexibility and help you overcome the impairment of a shoulder impingement. Take care, and we'll see you next week.